Hello, everyone. My name is Robert, and today I am going to be doing my presentation on influenza. If you didn't know, influenza is also known as the flu. It is an infection of the nose, throat, and lungs. And the good news is that most people do tend to get better on their own. Most people do get their annual flu shots, which do lower the chances of having severe complications from the flu. And then a good way to prevent it is just disinfecting and cleaning the surfaces that you work on or commonly go to, and then washing your hands constantly. Some of the symptoms: sore throat, running or stuffy nose, fever, cough, headache, muscle aches, feeling very tired, and sweating and chills. And then a good thing to note is that the flu affects you quickly, unlike the common cold. Within 2 or 3 days of contact with the virus, you'll already feel its effects. Whereas with the cold, it's a slow buildup. And then some of the origins. We don't have an exact day and time when influenza began. We're not sure when it specifically started, but we do have some early evidence of it in 412 BC in ancient Greece. Hippocrates described a highly contagious disease with flu-like symptoms in his 6th book. Then in 1357, when people called an epidemic in Florence, Italy. And then in 1580, we did have the first flu pandemic. Most epidemiologists agree that the 1580 influenza outbreak is the earliest recorded flu pandemic. And then, of course, there were other pandemics and outbreaks throughout the centuries. Just name a few. In 1729, one started in Russia and spread throughout Europe. 1781, it started in China and spread to Russia, Europe, and then on to North America. And then if I have a patient that comes in when I suspect he or she has influenza, I would first do a rapid influenza diagnostic test, RADT for short. It's the most common type of flu test, and it can provide results in as little as 10 to 15 minutes. If you guys have gone COVID tests, it's pretty much the same thing. I would insert a swab into the patient's nostril to get a sample, and then this swab would then be placed in a test tube containing a solution that extracts viral antigens from the sample. And then this sample is then put in the RADT device. And again, within the 10 to 15 minutes, we will find out if the patient has influenza. After that, we could recommend treatment. So the medication that I would prescribe to the patient is an antiviral medication. It's oseltamivir, otherwise known as Tamiflu. It is used to treat and prevent influenza by stopping the virus from spreading inside the body. One thing to note is that I would only give this to the patient if they've only had the flu for 2 days. You only want to give it to them within the first 2 days. And pretty much what this thing does is it blocks the creation of new virus particles, which helps the body's immune system fight the infection. Thank you.